So, you know that feeling? Waking up in the middle of the night, pretty much every night, to use the bathroom? Yeah, you are definitely not alone. But what if I told you that nightly interruption is way more than just an annoyance? Today, we're going to break down why.
And let's be honest, most of us just write it off, don't we? We think, well, I'm just getting older, right? It's just a thing that happens. But what if that common assumption is just plain wrong?
Because here's the thing, the latest clinical science tells a completely different story. It suggests that those nighttime trips are actually a critical signal from your body, a potential warning sign about your overall health, and we're going to get into exactly what that means.
So to really understand why this is such a big deal, we have to look past the interrupted sleep. The impacts this has on your health and, your quality of life are serious and they're actually measurable.
Okay, so there's an official medical term for this, and it's Nocturia. The International Continence Society defines it really simply: waking up from your main sleep period to go pee. So we're not talking about that trip you make right before you get into bed. This is about being pulled out of a deep sleep because your body is sending you a message.
And you know what's so interesting is that research has drawn a really clear line in the sand here. Getting up once a night? Okay, maybe it's just annoying. But the data shows pretty consistently that 2 or more trips, that's the threshold. That's when we start to see a real measurable drop in quality of life and a real increase in health risks.
And listen, this is not some rare problem. We're talking about almost 20% of adults between 20 and 40 dealing with this. And for folks over 70, hits a staggering 60% or even higher. So this is a huge health issue, not just something that happens to older people.
So what's the big deal? Well, the consequences are actually pretty serious. Nocturia just completely shatters that deep restorative sleep we need, which leads to brain fog and just feeling drained all day. But it gets more alarming than that. Big studies have linked it to a 20% increased risk of falls, a 30% increased risk of fractures, and even a 30% increased risk of mortality overall. I mean, this is clearly way more than just a nuisance.
All right, so if nocturia is this serious, the next question is obvious. What's causing it? Well, the answer isn't simple. It's actually a pretty complex web of potential issues, which is exactly why there's no single, easy fix.
And this is probably the single most important thing to understand. Nocturia is not the disease, it's the symptom. It's just the tip of the iceberg. The real goal is to figure out what's going on underneath the surface.
And when you look at the potential causes, wow, they are incredibly diverse. I mean, it could be a local thing with your bladder or prostate, but it could also be a sign of a much bigger systemic issue, like heart failure or diabetes. It could even be caused by a sleep disorder like sleep apnea, or hey, it could just be related to your diet or other meds you're taking.
And this whole thing creates a classic chicken or the egg problem. Obviously, waking up to pee is going to ruin your sleep. But a primary sleep disorder, like sleep apnea, can also cause your body to produce more urine at night. So, poor sleep can trigger the symptom, and then the symptom leads to, well, more poor sleep. It's just a vicious cycle.
So, with this whole web of potential culprits, how on earth does a doctor play detective and figure out the true cause? Well, it all starts with a very clear diagnostic roadmap.
The initial evaluation really rests on 2 pillars, and they are both equally important. First, you've got the comprehensive clinical assessment. That's your medical history, a physical exam, some lab work. And second, there's something you do yourself, the voiding diary.
And this diary is called the gold standard for a really good reason. It provides hard data. For just a few days, you track everything you drink and every single time you go to the bathroom. It sounds simple, but this little log provides the objective clues a doctor needs to see exactly what's happening inside your body.
And you know what this diary often uncovers? A condition called nocturnal polyuria. All that really means is your body is making way too much urine while you sleep. Normally, your body's urine production slows way down at night. When it doesn't, your bladder just can't keep up. And this turns out to be the single most common cause of nocturia.
Okay, so once the cause starts to become clear, what's the plan? What do you do about it? The treatment roadmap is actually very logical, and it starts with the simplest steps first.
The very first line of defense is always lifestyle changes. And for a lot of people, these can be enough. We're talking about pretty simple adjustments, limiting how much you drink before bed, cutting back on salt and caffeine, and making sure you fully empty your bladder right before you turn out the lights. But look, while those lifestyle tweaks can definitely help, the real solution, the thing that has the biggest impact, is treating the root of the problem. You got to go after the underlying disease that's causing the symptom in the first place.
And here is a perfect, kind of mind-blowing example of this. Take obstructive sleep apnea. For patients with this condition, simply starting CPAP therapy can get rid of 2, sometimes more, bathroom trips every single night. I mean, think about that. You fix a breathing problem to solve what seems like a bladder problem. It's just a powerful reminder of how interconnected our bodies really are.
It's also really important to be realistic about other treatments. Things like medications or even surgeries for, say, an enlarged prostate might seem like the obvious answer. But for this specific symptom of waking up at night, the research shows they often have a surprisingly small impact. The focus really should always come back to that root cause first. So all of this, it brings us to one final, really powerful idea. It's time to completely reframe how we think about this problem.
I mean, this quote from the clinical literature just says it all. Nocturia isn't just a bladder issue. It's a potential biomarker, an early warning sign that could be pointing to cardiovascular disease, metabolic problems, or other big-picture health issues.
So here's the bottom line. Waking up at night isn't just some inconvenience that's stealing your sleep. It is a form of communication. It is your body trying to tell you something really important. So instead of just dismissing it and saying, oh, I'm just getting older, maybe it's time to actually start listening. Because the most important question here isn't how to stop it. The question is, what is your body trying to tell you in the middle of the night? Thanks for joining us.